All right, so today we're diving into a really ambitious 10-year plan that's all about completely transforming England's National Health Service. It's called Fit for the Future, and, it's proposing some of the most radical changes the NHS has ever seen. So, what's actually in this plan, and why is everyone saying it's so desperately needed? Let's get into it.
Right out of the gate, the plan hits you with this incredibly powerful, frankly shocking statement from a recent independent investigation. It just sets the tone for everything else. We're not just talking about tinkering around the edges here. The report is basically saying the very survival of the NHS as we know it is on the line.
Okay, so before we can even talk about the fix, we have to understand what's broken. Why such a dramatic, reform or die call to action? Let's take a look at the diagnosis of the current crisis.
And this is where it gets real for so many people. These aren't abstract problems. We're talking about the daily grind of trying and failing to get a doctor's appointment, these massive ballooning hospital waiting lists, and crucially, the staff. They're demoralized, they're burned out. These are all symptoms of a system that's just under unbelievable strain. And the plan makes it clear, with an aging population, it's only going to get worse.
So that's the million-dollar question, right? If the way we're doing things now just isn't working, what's the alternative? How on earth do you even begin to reinvent something as huge and as beloved as the NHS?
Well, the plan's answer boils down to what it calls 3 radical shifts. This is the big picture strategy, the core prescription for what ails the NHS, and it's pretty much what we're going to explore for the rest of this breakdown.
And here they are, the 3 pillars. First, a huge shift in focus from the big hospitals to your local community. Second, a massive leap from a paper-based kind of analog system to one that's digital first. And third, and this is a biggie, a fundamental change from just treating sickness to actively trying to prevent it. The key thing to remember is how these 3 ideas are meant to work together to build a whole new way of doing things.
All right, let's dig into that first shift. The idea is to create a neighborhood health service, basically pulling care out of those giant centralized hospitals and bringing it way closer to where people actually live.
And this chart just lays out the difference so clearly. On the one hand, you have the current system, which the plan calls fragmented, reactive, and stuck in all these disconnected silos. The vision for the future? It's all about integrated, community-based teams that are actually predictive and preventative, with you, the patient, right at the center of it all.
So the physical heart of this new model is something called a neighborhood health center, or an NHC. The best way to think about it is like a local one-stop shop for your health. Open longer hours with a whole team of different health professionals all working together right there in your community.
So, what's the bottom line for you? Well, the plan promises this will mean an end to that dreaded 8 a.m. scramble for a GP slot. It means getting a same-day appointment when you really need one. It also means freeing up hospitals to focus on what they do best, really specialist care, and putting a stop to that awful spectacle of corridor care we hear so much about.
Okay, let's pivot to the second huge shift, taking the NHS from analog to digital. This is all about using modern tech to put way more power and control directly into your hands.
I love this little phrase the plan uses to sum it all up. Moving from bricks to clicks. It's as simple, right? It's about shifting away from relying on physical buildings for everything and moving towards a service you can access from anywhere. And the main tool for this whole digital revolution is going to be the NHS app. The vision here is to turn it into the new front door for the entire health service, effectively giving every single patient a doctor in their pocket.
And just look at what they're planning to pack into this app. It is a lot. We're talking getting instant advice, choosing where you get treated, booking your own tests, managing prescriptions, and even having video calls with specialists all from your phone. It's a huge, huge step toward giving patients more control.
But this whole digital push isn't just about making your life easier. It's also about something really important, transparency. It's about using all this data to make the quality of care much, much clearer for everybody. And how are they going to do that? Well, they're proposing these easy-to-read league tables, kind of like this mock-up here. You'll be able to go into the NHS app and directly compare different hospitals based on things like waiting times and patient ratings. Real data right at your fingertips. Okay, now for the third, and honestly, maybe the most revolutionary shift of all. This is about moving the entire focus of the health service away from just treating sickness to actively promoting health and preventing people from getting ill in the first place.
And if you're wondering why this is so critical, just look at this number. The report points out that almost 1 in 5 children leaves primary school with obesity.
Think about that. That's setting them up for a lifetime of potential health problems that the NHS will eventually have to pay for and treat.
So, to get ahead of the problem, the plan lays out some pretty bold moves, things like cracking down on youth vaping, restricting junk food ads aimed at kids, and even launching a health reward scheme to nudge people toward healthier choices. The big idea here is that a healthier country means less pressure on the NHS down the road. It's that simple.
So when you take those three big ideas, community, digital, and prevention, and you put them all together, what you get is a vision for a totally reimagined NHS. The plan is really clear. It wants to hold on to those founding principles of universal care free for everyone, but it wants to completely overhaul how that care is delivered to make it ready for the 21st century.
But look, a plan on paper is one thing. Making it happen in the real world, that's a whole different ballgame. This is a massive vision that's going to need huge changes to funding, to technology, to the whole culture of the NHS. So it leaves us with one final crucial question. Is this the radical reinvention the NHS truly needs to be fit for the future? That really is the big question, isn't it?